Welcome, Dr. Mandell here with you. I have a great technique I want to share with you, particularly those who have chronic neck and head problems. We're talking about neck pain, motion restriction, tinnitus or ringing, vertigo, TMJ, headaches, any type of neurological problem that's existing from the suboccipital area, which I'm going to explain to you, can potentially be helped by this technique. Our goal is to focus in the suboccipital region. You have the occipital condyles, which is the bottom part of the occipital region behind the skull that sits on the first vertebrae, the superior facets of the atlas. If you look here, the back of the condyle sits right on that first vertebrae, and you should be having movement in there going upwards and backwards, upwards and backwards and sideways. If you're lacking mobility in this area, this potentially can cause irritation on this major network of nerves, as you see right here. They control many different areas that I just mentioned. So our goal today is to restore mobility, to restore motion, to reduce adhesions, which is like scar tissue, because if this area is adhesed in one area, maybe potentially the type of work you've done from an old accident, from a fall, or even sleeping incorrectly, something potentially could have caused something that could have been there a long time. Those nerves become inflamed and irritated. It's like stepping on a garden hose, trying to water the garden. The water's not getting out into the garden. The plants are not doing well. Well, the energy from the brain is not getting through this area because of what's going on in here. So if we can reduce that interference by restoring mobility, we're going to bring more function into your body and to allow your body to heal much quicker. So our objective is to put the base of our hand right in here underneath the back of our skull on one side, and then we'll take the base of our hand and put it on the back of the skull on the other side. And what we're going to do is we're going to try to increase motion into the occipital area. Hopefully that will make a change in your underlying condition. What's nice about this, it's safe and it's very effective. No, we're not adjusting the spine. We're not thrusting in the spine. We're gently taking the base of our hand, applying it underneath, and we are turning it and lifting upwards. We're turning it and lifting upwards, okay? We're turning it and lifting upwards. So as we turn our head, we're lifting up on those joints so we can get that gliding motion back in to where it belongs. Okay, so to do the technique, it's very simple. The contact of our right hand works with our right occiput. The contact of our left hand works with our left occiput. The occipital area is the base of the skull. If I turn around, you'll use this part of your hand right here, bottom part of your hand, and you're just going to push it up under here against the lower part of the skull. Just see how my fingers are wrapped up like this. So I'm underneath. Now you'll take the other hand, and as you turn your head to the left, this hand right here will guide you. Just going to help you turn. So this is what it's going to look like this. Okay? Now the key is that when you turn all the way to the end, you're going to push this hand up. So you're going to kind of stretch up in the condyles to restore that movement. This is what it looks like. Okay, push, come back. Turn, push up, come back. Beautiful. Turn, push up. Wow, beautiful stretch. Push up, make sure you push up, feel it stretch underneath the skull. Good, come back. Beautiful. So if I do the other side, grab the chin over here. This goes underneath the back of the skull, right here. This is what it's going to look like. Turn, push up. Nice stretch in the left occipital area. Push up. Good. When you push up, you're just going to hold it for a second or two. Push up. Now you're always going to push up at the end of the motion. Good. And what that's going to do is that's going to lift up on the occipital area and reduce those adhesions to increase that mobility. Again, this is not an adjustment. This is a subtle, light motion to restore mobility to help restore function. I really hope that this makes a big change in your health condition. Remember, some people may respond within one particular session. Other people may take 5 or 10 sessions. It depends how long these conditions have been there. I ask you to share this video on your social media. Please leave your comments below. You're going to get hundreds or even thousands of people who are going to read this. Check me out, Motivational Doc, on Facebook. And most important, make it a great day. I'm Dr. Alan Mandell.